So you were discussing standardization, like after Mao.
Oh yeah. So they went to, from what I understand is like the government sort of went around and asked all the acupuncturists, okay, where do you locate this point? Where do you locate this same point? And they were all like, well, it's here, 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 and here. And then they kind of took those and was like, okay, the mean of all of those is this point, and that is now the official point.
Yeah.
And that is the government-sanctioned point. And that is how we now have the acupuncture points that we have today. Before that, a lot of it was like lineage-based. You know, like families, sort of like people teaching other people, like acupuncture is this. This point is taught here, but really it's located here. So now these days you have lots of people who are like, well, I've learned this lineage of acupuncture. So Master Deng style is kind of like that. At least that's what my teacher, that's how she informed it to me. Was that, you know, like these points are traditionally taught here, but you can actually locate it here. And from what I understand, if people didn't practice the sanctioned points, that was sort of illegal and they could be like jailed or punished. So some people fled to Taiwan to practice their more lineage style there.
Yeah. It sounds a lot like, I make comparisons mentally between Thai massage and then martial arts, where it's a lineage-based system,
right?
You know, teacher to student, and then I talked to Shai Plonsky yesterday, who's a Thai massage practitioner who has different teachers than me, and we really connected. And as we talked behind the scenes, not on camera, it was like, who did you study with? And we started talking and comparing notes, and it's like we both have had history of like falling outs with our teachers, and you know, it's like, and this seems to happen again and again. I think in more lineage-based system, it's like because the student commits heresy by questioning what the teacher taught and changing it in some way. Yeah.
Right. Yeah. Except like that's medicine.
Well, the thing is, like when you talk about points, my guess is I know it's like this with anatomy. If I'm discussing something like I address what I consider referred pain, I'll commonly use the colloquialism trigger point.
Mm-hmm.
But it's like the muscle and where they feel referred pain is not always exactly the same. So there's some variation. And the thing is, it's like, I could say, okay, my TFL has some issue, but your TFL is longer. You're taller than I am. It's like your anatomical structures are not the same.
Right.
And then as a practitioner, your body mechanics and leverage is different.
So we treat a lot of back pain in acupuncture, and the sacrum, right, is kind of like pivotal for that. There are some points where you actually go through the foramina, like, mm-hmm. right, like, and finding those on people. Sacrums are like snowflakes.
Yeah.
You know, and that's, I feel like until you do a lot of body work and palpation, you kind of just think as like everybody having the same skeleton. But no. Mm-hmm. So the idea that like a point is going to be, you know, this many like centimeters from the midline of the body is impossible.
Yeah, just students, when it's applying pressure, they want to know, well, how much pressure? And I go, okay.
The right amount.
But the thing is,
Goldilocks that shit.
It's going to depend on your client and the amount of pressure they can receive, which means you have to communicate with them. And they go, oh.
Like, I have to talk to
like,
people?
I can't even, wow, because they want like this perfect sequence they can apply. And it's like, no. The sequence is just a starting off, a jumping off point for connection with the client to find out how much pressure is going to work.
Yeah.
Like, would you like more pressure or less?
Right.
It can be that simple, but even the process of asking the person for feedback means that I'm including you in my treatment. It's not a catch-all. It feels to me, again, it increases intimacy.
Yeah. There's argument within Chinese medicine around that, right? Like different shaped bodies, like and injuries, right? Like if you break a muscle and break a bone, break a muscle. If you break a bone and it heals back deformed, does the channel change shape, right? Do things move around that? Or do they just go through it, right? Like, my personal belief is that things, like, organically change. There are other people who think that it doesn't, but I disagree.
I think generally, not even knowing your field, I agree more with your stance on that.
Yeah, and so but it's really interesting because traditionally I think like there is room for that. We talk about Sun measurements, C-U-N, Chun, Sun. My Chinese pronunciations are terrible, so we always just say Sun. But Sun measurement is actually supposed to be a proportional measurement based on your own body. And so the idea is that like a point is 3 sun out from the midline, then it's their 3 sun, not your 3 sun. But people don't necessarily do that. Some people think of a sun as being an inch, you know, and on a much smaller person, like 3 inches is like you're way over here. You're on the side of their body.
I would assume that acupuncture, much like a bodywork practice, bodywork and massage, the students seem to think of it as an endpoint, like, well, I got my license, I'm licensed. It's like your growth potential is based on practice over, it's like you're still learning.
I had all of my teachers in school that I really respected were like, you really start to learn acupuncture after you get out of school. And I was like, I couldn't hear that in school.
Like, you were up to your eyeballs.
Well, but also, like, how do I, like, stay engaged in the material that I have to learn right now to get my license if what I'm hearing is that that material isn't very helpful, you know? And to an extent, that's been true. You know, our national board exams, our accreditation process is extremely tough. So a lot of what we learn in school is like it's been so standardized so that you can test for it and then take these tests, which are very hard. So a lot of acupuncture school is designed to just kind of help you pass your tests to get licensed, and then you get to actually like learn how to practice medicine.
Yeah.
Yeah.
And a practice, I mean, that's absolutely how I think of it. The students ask me, and I can tell they want a black and white answer for things that I don't.
Yeah, I have this. So I taught at AOMA for 3 years, and I would like clinical supervision. I would get that all the time. You know, the students be like, "Okay, what's the answer?" And I'd always be like, "The answer is it depends." You know.
Yeah.
And they would get so frustrated. They're like, I just need a black and white answer. And I'm like, this is not the medicine for you. Which is not fair. Like, it was. Like, but I would just be like, that's not how this works. I don't think that's how the world works. I don't think it's black and white, really. Like,
yeah, well, for me, it was always trying to help them, again, with like a method of inquiry. It's one, do no harm. How do we most optimally help the person? And then it's based on, in my experience, because I'm teaching Thai massage specifically, it's how do they use their tools and what is the client dealing with and what's the best way to like get them in a mental framework to be able to make judgments about those things and ask better questions to continue to allow their practice to evolve. I'm not going to be there with their client to be able to show them, oh, well, you know, I would do this instead. Sometimes if I show a sequence in class, it's funny to me, you know, the students go, well, she has a problem with this, because what I want to do is come in and say, oh, okay, well, I'll just work on her. But working on her is not a sequence. It's a sequence I improvised. And I can't get them to improvisation because they don't understand that 700 pages of sequence manuals I've already written in 9 DVDs. Like, that's just the basics.
But how did you start? Did you start improvising?
Sequences.
Right.
Yeah.
You know, I mean, and that's, you know, and that's the hard part about teaching is like, you have to teach the students all the rules so that they can understand everything enough so that they can throw all those rules out the window.
Yes.
But you can't throw the rules out the window until you've like learned like to operate in the rules. It's this weird catch-22.
I teach them sequences because I think biomechanically it's a basic template. And then as I'm teaching them the sequences, I say, listen, do this, repeat it, learn it, but don't feel stuck to it.
Right.
You're going to vary it in small ways. You're going to leave out a move on a leg. It's not going to be a problem. Generally you're balancing the left and right side, but at the same time, it's creating room for improvisation because sometimes either their body or the client's body doesn't fit the sequence that I've written.
Yeah.
Yeah.
Yeah, and it's everybody's so different. It always depends.
Yeah.
I'll never forget in years and years and years ago. This just stuck in my mind. It was so it's not profound, but it was. We were in our diagnostics class, and our professor was telling us we were doing a case study, and she's like, here is the Chinese diagnosis for this patient. And one of my buddies in class, he was like, well, I don't understand why that is, because I think based on this, it should be this. And she's like, that's a great point. And he was like, she's like, you've convinced me, and just sort of the idea that if that's what you're seeing, go there, right? And I think of it as sort of the same when treating musculoskeletal, and I imagine for you guys, the person's like, oh, I have knee pain, right? And you're like, oh, where's it at? And they're like, medial, and you're all up in here, and then you feel, and you wind up at the TFL, and you're like, oh, it's pulling this over, which is opening up that medial knee, right? And so you're working up here, and they're like, the fuck are you doing? I told you my knee hurt, and you're like, shut up. And then you just keep working, because they did, and it was and there was no awkwardness. And then they get up and they feel great, and they're like, oh, you were totally right.
It doesn't actually. It depends on how you approach it. And the thing is, I don't normally, and even remotely, you shut up, I'm the practitioner, I know what I'm doing, but at the same time, you're engaging with their pain, they know you're working on your pain, they know that I don't have scans, I'm not Superman, I can't see through them.
Totally.
And I go, listen, when I press in here, does that feel relevant to what's in here? Because I'm trying to draw that connection. Yeah. If I do that, they go, oh,
that's great.
Okay.
And then they have their own connection there.
Yeah. And the thing is, in the end, it's if it doesn't help them.
I mean, the only reason I bring that up is because my TFL is tight, and I do have medial knee pain from it, and I did not know that until I had a practitioner do all of those things for me.
Yeah.
And I was like, why are you up there? He did not say shut up. He was like, it's tight.
Yeah. Sometimes, when it comes to education, I talk about video content. Just from a massage therapist standpoint, the general public does not know origin and insertion of specific muscles. So if I'm talking about TFL and I talk about its origin and insertion,
keep talking. I'm going to go get blue.
And I bring out an anatomy chart, show that anatomy chart on the wall to the client, and point out, hey, you've got a muscle right here. It goes from this point to this point. I think the top portion of these fibers might be shortened, so it's pulling down this chain. That explanation was so simple. I think it helps me connect with the client where I'm not saying, well, you have a TFL, trigger point. Well, they don't know what TFL is. If I said it's tensor fascia lata, well, tensor fascia lata is a Latin term. They don't know what that is either. And I say, hey, it's your tensor fascia lata. It's called your TFL for short. It's just a muscle that runs from here to here. That information goes a long way to educating the client in that session. But then what I had a tendency to do over time was I made videos about that specific muscle. And then after the session, I could send them a link to that video so they could review it. And my hope was that they like the video, share the video, comment on it, and go, wow, thanks so much. Because as a massage therapist, what I just did is I went above and beyond. Right. It amazed me the number of people I talked to that said, I've never had a massage therapist educate me. That was their statement.
Wow.
And I mean, and at all? No.
Interesting.
You hear your rhomboids. They're the muscles in your back where I was pressing on along your spine. Hey, here's what they do. I think they're overly stretched because your front is tight.
You're a teacher. I'm a teacher as well. I think we tend to want to educate. We're drawn to that. So I get my patients. I'm always educating as well. I'm like, oh, just talking about everything. And I find most of my patients, the ones that come back, are people who like that. They're like, oh, that's, they're the type who want to engage around their body. They want to learn about it. People who don't come back are the ones who are just kind of like, are you going to shut up? They're like, oh, that's interesting. I was talking with my friend Jerry, and he was talking about the Midwestern version of bless your heart, which is, oh, that's interesting.
That's interesting.
So I get a fair amount of that. I mean, not really, because those patients, you draw the type of patient that you want.
Yeah.
And furthermore, I think you draw the type of patient that you are. Is what I think is even maybe like a stronger statement that I think we haven't quite actually figured out a lot of times.
Yeah.
So.
And also, I think from when I talk to you about video production and an audio-visual standpoint, people get a chance to see your face, they get a chance to hear you, they get to connect with the fact that you're trying to educate. And it's like, in the end, I think it's too much effort to try to be fake. It's much easier to just be lazy and be authentic. Just be you, and it's like, Blue's barking. Why is Blue barking? Whatever.
Why is my dog?
That sort of thing actually breeds, I think, a little bit of authenticity, and it's like people get a chance to connect with you specifically, which is what you want, even through video.
Yeah.
So cool. Thanks for talking with me today. It's always a pleasure.
Nice to meet you.
Shoot some more soon.
I would love to.